Have you been diagnosed with cancer? Do you know somebody who has cancer? If the answer to that is yes to both either one or two questions, then I'm sorry. I'm really truly sorry that you're dealing with a cancer diagnosis. But I also am saying I'm sorry because I believe that many people who have cancer have been misinformed. And so today, I want to make sure that you have another kind of information. So what I call new truths. These are information, news that you may not hear from the social media, mainstream media, and even if you're watching it on YouTube or Facebook, or it might be taken away and you might be seeing this on BitChute. But today, we're going to talk about how 1 in 3 people are diagnosed with cancer and why. Why is this happening? And could there be another way to treat it prior to choosing alternatives like, or the conventional? Conventional. To me, conventional is alternative. So today we're going to be talking with another wonderful doctor that I met at the Annie Appleseed Project Conference and Best Answers for Cancer, and it's Dr. Henning Saupe. And what I loved about his presentation is that he empowers his patients. Not only does he look at the holistic side of cancer, he looks at the functional, integrative, and he understands the conventional treatment as well. And today we're going to be talking about the holistic treatment of cancer.
And when you need a friend, you can count on me. I'll be right here waiting for you.
Hi, my name is Lillian McDermott, and I am a certified life coach and the host of the Lillian McDermott radio show, Classroom. If this is your first time tuning in, then no, I've been waiting for you. This is a safe place where you can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening, as well as my viewing friend, will feel empowered to embrace a new truth and live the life of your dreams. Now, as I mentioned to you before, I went away for about 5 days, and I had the pleasure of diving back into something that's dear to my heart, which is a natural way of treatment for cancer. And I met this wonderful doctor, Dr. Henning Saupe. He's an MD, but classically trained, but somewhere along the way, he went over to the side of functional, holistic, integrative, and natural. And since it is our sole purpose in life to give and receive love and knowledge, I am grateful that Dr. Henning Saupe is here to do just that. Welcome, Dr. Saupe, to the classroom.
Thank you, Lillian. It's such a great pleasure and an honor to be on your show in your classroom today. I'm excited to have this conversation with you and your audience. Thank you very much.
It is my pleasure. You know, this is information that's being suppressed, as you know. And as a classically trained physician, you're a medical doctor. I would love for you to share a little bit about your background and what led you from being classically trained to being more holistic, functional, integrative, and natural, and then why choose cancer even after that. So share a little bit about that.
Well, that's the question about my life and my biography. Thank you for this question right at the beginning. Well, my huge interest for life sciences that I developed during my time at high school brought me to medicine, because medicine brings it all together: chemistry, physics, psychology, genetics, immunology, and all the aspects, even spirituality, if you have an open heart for the spiritual aspect of medicine. And that was at the end of my time at the high school in Germany, where I found this is what I want to continue to do in my life, because medicine is all about life and human beings, and we human beings are spiritual beings making a very, very special earthly and physical experience during our lifetime. So this broad spectrum of characteristics and topics that are covered in medicine were the reason why I choose medicine and not anything else. And then I had the great pleasure and honor to meet a doctor who was, or he's still alive, a naturopathic anthroposophic doctor in my hometown, and his eldest son was my best friend at school time. So every time I was at their home and had the chance to talk to him, I got the impression that this is really what I want to do in my life. He was a general physician, and with this broad knowledge on herbal medicine and homeopathy and naturopathic medicine and the spiritual background. So that was like somebody who inspired me to have a deeper look at medicine. And so I chose medicine. I applied for medical school and university in my hometown in Ulm in southern Germany, and started to study regular Western world medicine, to find out that many of my interests were not covered in all the special lectures and training we got. We got an excellent training in biochemistry and anatomy and physiology, but what we did not get is an understanding of what life is about. Believe it or not, medical doctors who get their training in a Western world university, and I know it from close friends in the United States or in other countries, it's the same in Europe as it is in Canada or in the United States or in Australia or in other places of the Western world, that the training that a medical student gets follows a reductionistic primer. So the complexity of life is from day one looked at with a reductionistic approach, and reductionistic means we reduce the complexity of life to models that we believe can handle with the therapies that we eventually use and find. The second quality that I found out that dominated my medical studies was a materialism. So spirituality didn't matter or did not exist. And so it's a reductionistic, materialistic approach that medical students around the world are trained in and become experts. And the tools that they get eventually in their hands are tools to block the symptoms of diseases that we don't want. So modern medicine is more or less the art of blocking symptoms. And sometimes that can be life-saving and really successful and important, no question. If we have a severe bacterial infection, we need an antibiotic. In most cases, we need it. Or if we end up in a traffic accident and have a bleeding and a fractured leg, we need a surgeon that fixes the problem.
Of course,
so
yeah.
I praise modern medicine in these specialities of acute medicine, but what I did not get in all the 7 years at University of Ulm in my basic medical training was an understanding of what life is about and what healing is about. And that is what I had to look for and to deepen my knowledge in seminars and workshops outside the university. So my interest for what we today call complementary or naturopathic or holistic medicine started right from the beginning. And I realized that the medical training I got at the university covered one aspect of it, the physical, the material, the anatomical, the chemical aspect of medicine and the art of treating diseases. But healing was of a different quality that did not get any answers or strategies that I was trained in at the classic medical training at my university. That's what I had to learn outside the medical world. So right from the beginning, I tried to cover both aspects. My heart was from the beginning more in the art of healing. And yes, I use the word art. It's more like an art that uses classic science to find ways to accomplish or alleviate healing. But at the end of the day, medicine for me is the art of alleviating healing. And here we have another concept that is a key concept for holistic naturopathic medicine, and that is the self-healing capacity of man. There is something within us that has the potential to heal ourselves from all the ailments that we go through our lifetime. And a medical doctor is somebody who is asked to alleviate healing, to take away the hindrances for healing. And that has been the concept in medicinal systems before the time of materialism in both China and India, but also in the antique world of Greece or the Roman Empire, that medical doctors were healing alleviators, taking away the hindrances and the obstacles for healing, knowing that there is something that we call the self-healing capacity of our body. Today we would look for it in our immune system and in the complex regulatory systems of our hormonal glands and the interaction between hormones and gut health and immune system. All this is what we today as modern men can understand as the self-healing capacity of our body. And that is not addressed in a regular medical training for a medical doctor.
Yeah.
So that is what medical students have to study outside their alma mater at the university.
Yeah, and most don't, and a lot don't. And I like to honor doctors that do look outside their education. That's very important to me, and why I honor doctors like you. But cancer in particular, so you're not an oncologist, and you're very clear when you were giving your presentation that you're not an oncologist, you're a medical doctor, and you chose cancer was it because of your mother's influence?
That's right. That was how cancer came into my life, through my dear mother, who was diagnosed with breast cancer at the age of 50. I was a medical student at Ulm's University when she came home and asked me, could you have a look at my breast? I feel a lump. And that was only 2 months after she passed through a mammography without any pathological findings. So we believed that everything was okay, but it wasn't. There was a lump. It turned out to be a cancerous lump. She went through surgery. She got a relapse. She eventually developed liver metastases and died 4 years later from metastasized cancer. And that was a very, very sad and hard experience for me, that my academic teachers at the university that became her doctors, the surgeon, the oncologist, the gynecologist, couldn't help her better than surviving the first diagnosis by a little less than 4 years. So that was, a disaster, a sad event for me as a son, but also a proof for the inefficiency of the standard approach to deal with a cancerous disease that is a very, very common cancerous disease. 1 in 8 women today face a diagnosis with breast cancer, and the trend is 2 to 3% more every year than the year before. So we have all the reasons to ask ourselves, what is going wrong? Why does this disease raise in prevalence every year? So that was when cancer knocked at my door for the first time in a very, very personal way. And you just said very correctly that I'm not an oncologist, and I would like to elaborate that a little bit.
Yeah.
After 30 years
Yes.
dealing with cancer, I wouldn't mind calling me an oncologist, but I'm not a board certified specialist in oncology acknowledged by the German Board of Oncologists.
Well, go ahead.
Yeah, if I would have gone that road, I wouldn't sit here today and talk with you about holistic oncology. I would be somewhere at the big hospital and providing chemotherapy to my patients, and that is exactly what I don't want to do, and that's why I'm not an official oncologist, but a medical doctor with a fully licensed medical doctor in my country. I'm a general practitioner, general physician, deliberately specialized in oncology for the last 30 years. So there is no exact title for that combination, but some patients call me a holistic oncologist, and I like that title.
I like that too. There are training and education. I know a few holistic oncologists. No, I like the fact that you didn't choose the oncology path. And as a matter of fact, every doctor that I speak with that has gone, well, most doctors, when they look at a particular field, it's, and they may have started in oncology, or they may have started as a regular conventionally trained doctor, but then they realize that all they're doing is prescribing They were trained to prescribe, not treat the whole body, which is something that I like about your clinic. And by the way, his clinic is Arcadia in Germany. And so I'll give you, I'll give you the link to his website a little later. And I know that you've written a book, and we're going to be talking about your books in a little bit as well. But I want to start establishing, you saw the conventional treatment that your mother received. I've seen in my life and the people that I've loved, and the conventional treatment of that these patients with cancer have received versus what you now provide for your patients. Can you compare, contrast, the differences, the major differences that you look for now as a physician that works with cancer, with, the functional, you look at the whole body versus the conventional. Can you just give us a little quick recap of that?
Yeah. Well, what we do from morning to evening here with the patients that come to our clinic from all over the world is we look for the best treatment available based on individual assessments, many very specific individual tests that we do to find out the weaknesses of the patient's organism and to get an answer for the very, very important question: how did it happen that this organism allowed cancer cells to grow, knowing that we all have a few cancer cells on board? Some 20 years ago, I read for the first time in my life an article that told me that, hey, cancer cells do not fall into a patient's body from the outer space. They have been inside the body from the beginning of our life. The truth is that we're all born with preforms of cancer cells, and every day we happen to produce a few hundred cancer cells. That's a modern understanding of what's going on behind the curtain. So do we all have cancer? Yes and no. Yes, we all have a few cancer cells. No, we do not suffer from the disease called cancer. And what is the difference? What is the difference between having a few cancer cells and having the disease? Well, the difference is to be in control of a tiny little amount of cancer cells. That is the definition of a healthy individual that does not have the disease, or being not in control any longer and providing cancer cells with a fertile soil so they can develop into a disease that comes with tangible lumps and metastases and eventually show up with a lot of symptoms and threaten our lives. So that's the difference, is being in control of a few cells that are out of balance or not being in control of. And here we are. The answer that I just gave you and the audience is an answer that is at home in the world of health science. What is healthy? Healthy is to be in control of many, many systems and balances inside our body: the pH balance, the oxygen versus carbon dioxide balance, the toxicity versus detoxification balance, and also the balance between a few cancer cells and a growing cancerous lump that is out of control. So, by the way, the science that asks questions like what has gone wrong in this organism, so the organism allowed cancer cells to grow, is at home in the discipline called salutogenesis, the science of health. And that was one reason why I wrote my book, Holistic Cancer Medicine. I wanted to bring this knowledge to the readers. What do you need in order to get healthy again, or to get back your control, your lost control of cancer growth? And that is not the lack of chemotherapy or the lack of radiation or surgical knives inside your body. That is the emergency treatment at the end of a long procedure where the loss of control happened some years before the lump becomes visible. And the message is that once cancer has become a fact in somebody's life with a tangible lump that causes symptoms, so you go and see a doctor. At this point in time, patients need two types of doctors: the ones that take care of the acute problem and the ones that take care of the organism to be able to control cancer again after a successful surgical therapy.
Okay.
And so what do? We make a in-depth, comprehensible individual assessment where we check for toxicity, hormonal imbalances, deficiencies, mineral, vitamin deficiencies, nutritional deficiencies, toxic load, infected areas in the body, like infected gums or root fillings, etc. The list is long of things what we check in order to find the risk zones that we need to reconstruct and to rebuild, because it's the entire organism that influences the control of cancer cells. And if we have infected root canals and the immune system is busy taking care of a chronic infection in my gums and in my root canals, then my immune system is not strong enough to keep cancer under control. And everybody needs an immune system that keeps the body alive and cancer under control after successful treatments with surgery. That is no question. And the pitfall of modern reductionistic oncology is to ignore the importance of the self-healing capacity of our body, the importance of our immune system, the importance of the detoxification pathways of our body. Because if you only block what you don't want, you do not get what you want. You need to work on the other side too. You need to build up your immune system. You need to build up your detoxification and your inner stress balance. And if you only rely on the modern drugs that oncologists in big hospitals recommend you, then you get what is published in the articles around these drugs. And that is one of the many jobs I have, is to inform my patients and give them choices. And almost nobody understands and reads the literature to understand what a modern drug can bring for a patient in a stage 4. It's the numbers are really far away from what patients want, and not everybody is informed to just drop a number that is published. And I have the reference in my book, published by a British oncologist from London, Charles Swanton. He summarized the effect of modern immune therapy to the prognosis and survival rate of patients in stage 4, and the number is a shocking 2.3 months in average life prolongation from therapies that cost many $100,000 per patient. And that number is not very well communicated with patients that believe that now they get the super immunotherapy drug and put all their hope and faith on this drug as if it was the silver bullet. And the truth is, it's not the silver bullet. It has a chance in average to prolong their life by a few months. So we have all the reasons to do more than what the pharmaceutical companies want us to do, and that is to sell their products.
You know, when I hear you speaking, I know that deep down inside that many, when and especially in your intro, you talked about how the Western looks at the body, and it looks like it looks at the body. It looks at I think, what else did you say? I can't remember exactly the two things that you said. Financial, the physical, and the body. But we need to look at also, there was a terminology that you used during the conference, which was
psychoneuroimmunology.
Yeah,
So
immunology.
Western world reductionistic medicine looks at our body as if it was a factory for chemicals, but we're not a machine. We're not constructed by an engineer, and we don't follow the laws of physics. Partially, we follow the laws of physics. Yes, gravity has an influence on our body. I can fall down to the ground and hit my head. Yes. So yes, I am a physical being, but everything that has to do with regeneration, growth, differentiation of cells, detoxification, metabolism does not follow physics. It follows the laws of life. And for 150 years, the medical science has tried to squeeze life into the framework of physics and not been able to reduce the phenomena to the physical world, because we do not follow plain physics. It's like Isaac Newton described gravity by looking at an apple and observing the apple falling down to the earth, and that made him be the first physicist to describe the laws of gravity and the mathematics behind it. But the question is, how did the apple get up to the tree? And that is not what you can describe with physics that follows the laws of life.
Yes.
How did the tree make the apple? And that
Yes.
is out of air, out of sunlight, and a few minerals from the soil. So
Right.
that's a very, very interesting question. And again, the field of science that deals with this question is salutogenesis, the science of life. And that is what the readers can, the audience today can read about in my book, Holistic Cancer Medicine.
Yeah,
and in
go ahead
other
and show the book. Show the book,
Yes.
Dr. Saupe.
Here it is.
Yeah,
Kelsey
yes,
Green published it a year ago, Integrative Strategies for a New Approach for Health and Healing. And it starts with chapters about life. What do we need? What food do we need to eat? How much water do we need to drink? What kind of water do we need to drink in order to get all the chemical cycles alive? What do our mitochondria need in order to be powerful and help us to live a long and healthy life? What do we need to control infections? What do we need to control inflammation, etc., etc.? So the first chapter of the book is a guide, a guidebook for
prevention.
the art of living a healthy life.
Yeah,
and
yeah.
then it becomes more specific and explains the biological characteristics of cancer and what cancer cells use in order to survive in our body, and what we can find in natural plant medicine, but also in modern pharmaceutical medicine, to get the best result, to block cancer, but at the same time vitalize the body and help the body to detoxify the drugs that we need in order to block cancer. So it's a complex interaction between life aspects, natural aspects of our healthy biology, and then towards the end of the book, a description of the techniques that we can use to reduce cancerous masses, but as long as possible in a non-toxic way that allows us to have a good quality of life.
Mm-hmm.
So, and this is the answer, sorry, it was a little long answer to your question. What do we do with patients? We study them very, very comprehensively with a lot of tests, biochemical tests, blood tests, stool analysis, heart rate variability tests, etc., to make a map of the patient's virtues and weaknesses. And the weaknesses needs to be looked at and to be addressed in the treatment. And then we also do very specific tests at laboratories that we have in our network that identify the characteristics of the cancer cells in this particular patient, because we learned that one size fits all is not a good answer. If you look in a standard guideline how to manage a breast cancer patient, the recommendations in the guideline can be totally wrong. Sorry, guys, in mainstream oncology, it can be totally wrong because this particular patient does not follow the law and she requires a different treatment because her cancer biology is totally different. And what I just said is more and more acknowledged even in standard oncology, because we learned that breast cancer can be two totally different types of aberrant cells that we need to understand better through a more thorough and in-depth diagnostics. And the laboratory that we cooperate with does, for instance, a complete genome analysis of cancer cells. That was impossible 5-6 years ago, and now it's available and it's affordable. So if we send a biopsy to our laboratory, we get a complete gene map, and based on this, 22,000 genes are checked and identified. And out of this huge database of 22,000 genes, a computerized system calculates out the pathways that the cell uses to survive in the patient's organism. And based on that analysis of the pathways, the computer tells us what drugs are likely to work and to help this patient in the best way. This is cutting edge, modern science, laboratory science, computerized analysis that we use. So complementary medicine is not only about herbal teas and poultices and spirituality, it also uses the cutting edge tools that are available and that mainstream medicine probably will integrate into their guidelines in 10 years or maybe in 15 years, because it takes years and years and years and hundreds of millions to prove in large clinical studies that our approach is better than the mainstream approach. But I don't need a $100 million study to prove that if I do an individual assessment, the result is likely to be better than if I would follow the one-size-fits-all recommendation.
Absolutely, without a doubt. Now, that in mind, I want to go a little deeper because I know you guys dig a little deeper. How does emotional trauma affect that cancer cell?
Wow, thank you for that question. That's another big chapter. And again, I refer to my book. That's the second part of the book where I go into the depths of psychoneuroimmunology. To explain the word one more time, about 25 years ago, the scientific world accepted a new discipline as being a serious scientific discipline. It's called psychoneuroimmunology, and it binds together psychology, the science of our emotions and behavior, neurology, the science of our nervous system, and immunology, the science of our immune system. And the term psychoneuroimmunology indicates that there is a connection, that these three systems are not separate. They exist in the same world, in the same universe, in the same human organism and body. And in plain English, it means that my emotions have an effect on my immune system as fast as I snip with my fingers. If this show inspires the audience, and if we manage to get their spirits uplift and in a positive emotional reaction, we have contributed to a better functioning immune system. And if we would do the opposite, if we would spread information that makes people sad and unhappy, then we would do harm to our audience, and it would be measurable within an hour. So that is what modern psychoneuroimmunology has proven. So back to your question, how do certain feelings, certain emotions affect the cancer cell? The answer fills textbooks. I have two behind me in my shelf. How can I summarize that? If negative emotions are the content of my mind, like emotions of sadness, of grief, of guilt, of fear may be the most important and most powerful one. If fear and shame and guilt is the dominant mindset of my life, these emotions trigger the hormonal glands in my brain to produce chemicals that block my immune system. That's a very clear fact that is shown in hundreds of studies and published in hundreds and hundreds of medical articles and scientific articles. So watch out for what you think. If you think something that does not feel good, if you think something that gives you a feeling of guilt and sadness and fear, the reaction in your brain will block your immune system with the blinking of your eye. And if you do the opposite, if you focus on something uplifting, if you believe that you are loved, if you believe that there is a reason and a purpose in your life, and if you feel love in your heart and share it with your family and your fellow man and your neighbor, the feeling of gratefulness and love empowers your immune system within seconds. Saying that, I do not tell the audience that a good feeling heals cancer immediately, but it contributes to a better control and a longer and more successful treatment and a longer life. So we need both. We need the best laboratory that does the most comprehensive analysis for tumor biology, that gives us ideas on what drugs we should use. And we need the best mental, psychological, emotional support to release toxic emotions and to practice mindfulness and gratefulness and a healthy mindset. And I do not use the term positive thinking any longer, because positive is not always healthy. Positive and negative are terms from mathematics.
Yes.
I rather say healthy emotions, because to show emotions is always healthy. Don't be afraid of your so-called negative emotions. Yeah. I tell my patients there are no negative emotions, they're but emotions. It depends on what you do with them. If you hold them if you hold on emotions of sadness and guilt and shame and fear, they become toxic. But if you express them appropriately without doing harm to anybody, just express it in an artistic way or in a psychotherapeutic way, the expression of the emotion is always helpful and helps your mind to process crises and find the peace of mind that supports health. It's proven time and again that peace of mind and gratefulness and forgiveness and faith and love are the qualities of our mind that contribute to healing in a way that is beyond our expectations as modern, more or less materialistic, reductionistic people. It's proven over and over again. Look at the work of Kelly Turner, the author of the best-selling books Radical Remission and Radical Hope. Look at the science around so-called blue zones, how people live in places that are called blue zones, where people reach an age of 100 or 105 and live 20 years longer than outside these blue zones. People in blue zones live a healthy life, and spirituality and the expression of healthy emotions is a component of a healthy life of a blue zone centenarian. So yes, emotions matter a lot. So what do we do here? We invite our patients to speak about emotions. We have a psychotherapist and an energy medicine specialist here at our clinic, Dr. Mona Meyer, and everybody here at the clinic is connected with the patient's feelings. We allow patients to be emotional. We do not follow a strict reductionistic protocol. We address them as fellow men and beings, and not as numbers or diagnoses. At the time I was and when I was a young hospital doctor, we spoke about the gallbladder in room 15 and the heart infarction in room 17, and that tells us all. Yeah, we look at patients as we reduce them to their symptoms, and that is really sad that it is still done in large hospitals, and that's not what we do here. We address our fellow men as human beings. We look into their eyes and ask them, hey, what went wrong in your life? What did you do the last 5 years before cancer hit at your door? Where were the crises? What inner conflicts do you live with? And how can we help you to find and eventually transform the inner conflicts into a mindset that alleviates and supports healing?
That's amazing. That's amazing. And you know what? And that is what people need to understand, that, you know, and I've shared this statistic before, that 5 minutes of anger reduces our immune system for 8 hours. And who's angry for 5 minutes? Who's angry for 5 minutes? Some people are angry for 20 years. And so, and then we wonder, why is our body not working properly? The brain doesn't know who it's angry with. It assumes it's you, and it will take it out on you. So if anybody's out there holding on to grudges, I'm hoping that just this, what Dr. Saupe said today, will help you just say, okay, I want to release that because I want to help my immune system build a stronger defense system. And so, and this is what we talk about here at whenyouneedafriend.com. And we're going to continue talking with Dr. Saupe in a little bit. But I just want to remind you to go to whenyouneedafriend.com. If you are intrigued and you want to learn more about the Arcadia Clinic in Germany, and maybe this is a place where you'd like to just go, and you don't have cancer, you just want to prevent it and heal your body, this is a place where you can go as well. And so, so go to whenyouneedafriend.com. If you're a subscriber, then you already have his information and the clinic information. All you have to do is click on their name and click on the clinic, and you'll be able to go straight there. While you're there at whenyouneedafriend.com, please subscribe to the classroom. You get lots of different, you get to be the first one to know who's in the classroom every week, and you get some discounts as well in the website. So go to whenyouneedafriend.com, subscribe, share this video with your friends, let them know that we're all about taking ownership for our life, being our own MDs, our own medical detectives, where we go dig deeper, we dig into our soul until there's only truth. looking back at you. So while you're there, please also check my social media accounts. Please subscribe to those as well. Like and follow them. Again, share those too. Then check out my sponsors. Figure out ways that you can support my sponsors the way that they're supporting the classroom. And then you can go to my Shop Now bag. And the Shop Now bag, those are all Lilly approved products from head to toe. I want you to play there and know that you will get lots of different perks from going in there. Now we have an event coming up soon, and that is the event for the I Am the Solution. What's the I Am? That's that voice that Dr. Saupe was talking about. He was talking about this knowing, this higher power, and that's the I am in us. And the solution is what we're called to do, to pick up our mat and walk. This is I Am the Solution Natural Health Summit. This is where we're going to come together and learn new truths about health, about taking our health back and being empowered to know that if we give our body what it needs, it will love us back, and it will love us hugely. So go to whenyouneedafriend.com. The event is on April 6, 2024. And we're going to come together with great speakers like Dr. Joel Furman, who will be zoomed in. He'll be the only one that's zoomed in, but he'll be able to see us, and he'll be able to see him and ask questions. Then there's Dr. Jennifer Gramuth, who you all love, and Dr. Thomas Levy. We have Renee Hahn and Brendan, and we have Claire Stagg. Dr. Claire Stagg is a dentist who looks at the whole body, looks at your mouth, and is able to predict what's going on, the diseases in your life. So she's going to be a speaker as well as Brendan, who's going to be talking about the Avasia product and how to be pain-free naturally. And of course, I will be there. I'll be your host, and I will be also the speaker about mindset, because without mindset, everything we say won't make any sense, especially if you believe this is not true, then I guess it won't be. But if you will become curious about it, it's amazing how these new truths will affect your life. And last but not least, you can become an enrolled student in the classroom, whether it's $1 or $1,000 a month, whatever you can provide, whatever you can donate to the classroom, whether it's your time, your talent, your treasure, $1 or $1,000 a month or a one-time donation, we need your help. So help in any way that you can. We appreciate everything that you can do. Now, today we have Dr. Henning Saupe in the classroom, and we are so thrilled that we get to speak to him. Now, he's taken time off from his clinic in Germany, and you can find him at Arcadia-Praxis Clinic, and clinic is spelled with a K because it's in Germany and not with a C. So it starts with a K and it ends with a K, so clinic. And so you can just click on the link in the blog, and I think I'll just add the link in the description below. That way you can just go straight there, because it's a German, and it's I never finished it. So it's www.arcadia-praxisclinic.de, and you'll be able to find the beautiful facility. I want to go there. So thank you, Dr. Saupe, for being part of the classroom today and teaching about waking us up, really, because there's one of the things that I notice when people have any form of diagnosis, especially cancer, that a way to manipulate is to instill fear. And I don't get that from you. I get a lot of hope. So share a little bit about what people experience when they go to your clinic. Do they get like a consult before they decide to go? How do you get people through the process of that fear so that they can make a wise decision for themselves?
Well, the process is patients are kindly asked to send us their medical documentation, and our secretaries take care of the medical documents. They send a questionnaire back to the patient that the patient is kindly asked to fill in and to send back with some standard questions. So that gives us an understanding of the actual situation. And then we are 3 medical doctors here. We look through the submissions very, very carefully and get back to the patient with a free of charge getting to know each other video consultation, where we present a first preliminary treatment plan and what we would do in this particular case, and then the patient proposal by email where all the treatments are listed and the costs of it, and then the patient makes a decision whether or not she or he wants to come to us. And the average stay for a patient with a stage 3 or 4 cancer, which is what most patients come with. Patients are allowed to come in earlier stages, but our daily work is most of the time metastasized cancer. The standard duration for the first stay is 3 weeks. Sometimes 4 weeks are necessary, but 3 weeks is a good way to start. We pick up our international guests from Frankfurt Airport, bring the guest door to door to our facility, and take care of you here like a hotel guest. And it's not a hospital
It's an all-inclusive, right? It includes food and yes, it's an all-inclusive vacation.
Yeah, it's more like a health resort. Have a look at our website, and at the maximum we take care of 10 patients at a time. Patients are allowed to bring a spouse, a good friend, or a family member that accompanies the patient during their stay. It's not necessary, but it's supportive, and the decision is up to the patient. And then we guide you through the entire process with all the diagnostics, the laboratory tests, the toxicology tests, the gene analysis, and we treat you with a combination of what we do and what is on our website: infusions, naturopathic anti-cancer drugs like turmeric and artesunate and Chinese wormwood and green tea extract and mistletoe and vitamin C and whatnot, a long list of drugs that we choose the best ones based on the laboratory results that we get for every patient on an individual basis. We treat patients with hyperthermia, which is a very special way to bring warmth or heat to the tumor or to the body. We apply detoxifying therapies, magnetic therapy, oxygen, hydrogen therapy, massages, singing bowl, stress reduction therapy, individual coaching. We have meetings in the afternoon where we talk about forgiveness and spiritual aspects of life, and do meditations and use also sound that we add to the therapy sessions. We have gongs that we use as process facilitators and alleviators in the therapeutic processes we do. So there's a lot to share with our guests. And what happens after the 3 weeks is that we send our patients home with a home care package of drugs and supplements, and we offer follow-up consultations, and then we ask the patient to do evaluation, CT scans or MRI scans and laboratory tests at their home hospital, and we discuss the results after 1 or 2 or 3 months, depending on the stage and the personal situation of the patient. So that is what we do, and it all starts with an email and the first contact through our secretary, and then we book a video consultation.
Yeah, and I think I have that email, and I'll also add it in if you guys want it. It's I saw that it was info@arcadia.praxis, no, not -praxis.de.
Yeah.
So it's info@arcadia-praxis.de.
Exactly.
So if you want that, you can just text me at 407-373-5959, and I'll give that to you as well, because this is great information to have, and it's wonderful to have a second opinion. I'm telling you, next year I'd like to do a summit just on cancer and have Dr. Saupe here with us, because the information you share. Now, I know that we only have about 7 minutes or so left in the classroom today, and but I do want to talk about insulin potentiation therapy, which is one of the topics that you discussed at the conferences that I was at. And I've heard of it. I've known about it. I think I've done shows on it in the way past, but not a lot of people know about it. I don't know why, but share a little bit about insulin potentiation therapy and who qualifies for that.
Okay. Insulin potentiation therapy was developed in the 1930s and 40s in Mexico. And the first doctor who invented this strategy was Dr. Garcia Perez, a military surgeon who found out that if we lower the blood sugar with a little bit of insulin, our body's hormone that controls blood sugar levels in our blood, then the efficacy of antibiotic treatments gets amplified manifold. So the first treatments that were done with IPT, insulin potentiation therapy, were combinations of insulin-induced blood sugar modification together with antibiotics, and it worked very well. He was successful in treating patients with syphilis in the late 30s, which was a breakthrough because syphilis was a dreadful infectious disease and the antibiotics of that time were not very powerful. But if you combined it with insulin and lowered the patient's blood sugar, the treatment became very successful. A few years later, Dr. Garcia Perez used the same technique to amplify the effect of cytostatic drugs, of chemotherapy, and it went very well. Medical studies were done. It became famous in Mexico. It became eventually famous in the southern part of the United States in the 50s and 60s, but it never reached the level of large clinical studies. Guess why? Because there was not very much money involved. Insulin is not an expensive drug, and insulin helps us to reduce the dosage of chemotherapy from theoretical 100% down to 20-25%. And nobody's interested to advertise a therapy that costs a quarter or a fifth of the standard therapy. So that's why no big studies were done. The patients that benefit from this therapy are all the patients that would benefit from chemotherapy. We do the chemosensitivity tests first with the cells to find out what drugs work the best. And then we use the drugs, the standard chemotherapy drugs, and our alternative complementary naturopathic anti-cancer drugs, turmeric, green tea extract, Chinese wormwood, mistletoe, etc., vitamin C. After having lowered the patient's blood sugar from normal to about 50% of what is normal. And that is a totally safe method. The patient feels a little weak for the 2 hours that the procedure takes, and that's all. There are no other side effects. A little bit of a feeling of weakness and feeling of, maybe a few sweat drops on your forehead, because that's how the body reacts to low blood sugar. It's under constant control of a medical doctor. The patient is connected to a monitor to make sure that the heart rate and blood pressure and oxygen and everything is working fine. And in all the years we've been doing it, and we do it like five times a day, we have not had one issue, not one case of mentionable side effects. And that is one of the major benefits of insulin potentiated low dose chemotherapy. It is not as toxic. It's almost non-toxic. I don't dare to say it is not toxic at all, but it's reduced.
I would add why you can say that is because you do the chemosensitivity test.
I do the chemosensitivity test, and I use only 20% of the dosage that the patient would get in a regular protocol, and that makes a huge difference. Compare it to a glass of wine versus 5 glasses of wine. That's about the toxicity difference. If we drink a glass of wine, we would have a nice evening. If we would drink 5, we would be terribly drunk and have a hangover next day and being intoxicated. So it's a huge difference if you expose somebody to 100% of toxicity versus 20%. And there are studies from the 70s and 80s published in the medical literature that have proven that the uptake of cytostatic drugs into the cell bodies under insulin modified blood sugar can be many hundred up to many thousand times. That's a powerful number. Methotrexate was absorbed by breast cancer cells in a petri dish 10,000 times more under insulin blood sugar modification compared to normal blood sugar with a standard dosage. We don't believe that the amplification in a patient is 10,000-fold, but it's many-fold the effect of what you would get without insulin, and that makes a huge difference. So it's an alternative, a non-toxic alternative in situations where you need to act and reduce the tumor, because growing tumors masses can be life-threatening. And We don't have the time in patients in advanced stages of their disease to wait until the immune system becomes totally normal or strong again. We need to act fast. If you have an aggressively growing tumor, you need to do something to stop it. And instead of exposing the patient to 100% toxicity, we do it with 20%, and the results are very promising.
You know, I think that we need to have a class just on that topic alone, Dr. Saupe, because it's just one of those things where people need to understand that, you know, that 5 glasses of wine is not as good as the one
That's
glass
one.
of wine. If you're going to choose to do wine and you're not
Exactly.
sensitive to wine,
Yeah.
that is a great way.
Yeah.
We only have like a few, like a minute left. Because when you're talking about sugar, let's talk really quick about sugar. I go into oncology centers, and there's cookies and sodas and Tootsie Rolls and all those things that are actually feeding the cancer. So what advice do you have to someone who has cancer right now about any dietary needs or
Yeah.
switching their
My
diet?
favorite diet, of course, diet is another big topic, and we could talk for hours, but my recommendation for most patients is follow a low carb diet. And what is a low carb diet? That's around 100 grams of carbs a day compared to the standard 350 grams of carbs, or you guys in the United States have an average of 400 grams of carbs a day, which is absolutely too much. So reduce it to around 100 grams a day. Get a book on low carb diet, download some recipes. It's not rocket science. Everybody can do that. And it's tasty. You can still make delicious dishes if you follow low carb guidelines. There is a special corner that reduces in dietary medicine that is called ketogenic diet, that requires a more individual assessment to find out whether or not that's a good choice for this or that patient. That's not what I recommend everybody, but it's another very interesting topic, ketogenic diet.
Another,
I would go the low carb way, which is around 100 grams a day, and reduce the fast carbs, the sugar, the white flour products. Go more for whole grain and more for natural sweetness in fruits. Don't be afraid of the sweetness of berries and exotic fruits, but avoid added fructose from corn and avoid added sugar. And that is a very, very important topic, especially for all our listeners that live in the United States, because the United States had a big problem with sugar.
Yep. And so grateful to you, Dr. Henning Saupe. And you can find him in Germany. You can go to arcadia-praxisclinic.de and start your journey. And if you have any questions, just call me and I'll just point you to him, because it's really long. The website link is long. And so thank you so much, Dr. Henning. I'll just call you Dr. Henning before we go, because that's the informal way of calling you. But I really do appreciate everything that you're doing. So thank you very much.
Thank you, Lillian. It was a great pleasure to have this podcast with you.
Yes. And please remember, we'll be right here waiting for you worldwide at whenyounneedafriend.com. This is Lillian McDermott and Dr. Henning Saupe wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. That's the best ever.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert